and welcome to another exciting episode of the USTM podcast series from the Ophthalmology Department of the Sangma International Medical College and Hospital, Meghalaya. I'm your host, Kipangwala Longchar, and today we're going to shed light to a very critical but preventable health issue, that is vitamin A deficiency, which is a major cause for night blindness and is especially found in malnourished children and can lead to severe eye disorders if left untreated. We have a very special guest with us, Dr. Indrani Goswami, Assistant Professor at the Department of Ophthalmology at Sangma International Medical College and Hospital, Meghalaya. Hello, ma'am.
Hello, Awa.
Welcome to the show.
Thank you for inviting me to this show.
So, ma'am, let's start with some quick questions to understand what is the basics. So, ma'am, can you please let us know what is vitamin A deficiency and how does it affect the vision?
Look, vitamin A is a fat-soluble vitamin which is found in abundant quantity in our body. But whenever there is some less of intake or due to some diseases, if the vitamin deposit decreases in our body, then it creates some manifestations, and this may be ocular manifestation and extraocular manifestation. If it's in ocular manifestation, these are mainly the night blindness. Then we have other symptoms like pidal spot, then dry eye, which may be conjunctival dry eye or corneal dry eye, and the ultimate thing which is to be we are to be afraid of is the keratomalacia, which is the melting down of the eye. That's all in vitamin A deficiency for ocular part.
Okay. And ma'am, can you please let us know why are malnourished children at higher risk for night blindness?
Look, in developing country, it's a very common disorder. So what happens? The vitamin A deficiency is a commonly caused of preventable blindness in case of under 6 years. And in developing countries, the people they suffer from malnourishment, and the mothers, they are usually malnourished from before giving birth, during pregnancy, and after pregnancy also, after delivery also. So the kids, they don't get the sufficient amount of nutrition from the mother, and after delivery also they are very undernourished. And this undernourishment, it causes again increase of infection. So in the infection increase means there is malabsorption of vitamin A, and moreover they are already deficient. All this leads to the deficient state of vitamin A.
Right. And ma'am, can you please let us know at what stage does vitamin A deficiency become dangerous for eyesight?
The initial stages which I spoke of now, the dry eye, the night blindness, all those are the reversible stages. But once it affects the conjunctiva dryness and the other part is cornea, which is the bright shiny part of in front of our eye, the black part, if it get involved, there is ulceration, opacity, and ultimately it gets melted, and that is the irreversible part of vitamin A deficiency.
So, ma'am, can vitamin A deficiency be reversed?
Yeah, definitely. If we get it early stage, like in the stage of night blindness and conjunctival dryness, in that case, if we get sufficient amount of vitamin A, then it can be reversed. But once the other stages are attained, it's not reversible.
All right. Thank you so much. Before we move ahead, let's bust some common myths around vitamin A deficiency. So, ma'am, the myth is eating more carrots can completely cure night blindness.
No. Never.
Alright, the next myth will be only children get vitamin A deficiency.
No, adults can have also vitamin A deficiency. The females, and moreover in patients having chronic liver disease, they suffer from vitamin A deficiency.
Alright, and then the third myth will be if someone has night blindness, they will eventually go blind.
It's never. Because if night blindness is treated at the early stage, then it can be reversed and it goes to the other stages, then only blindness occurs.
Okay, thank you so much for clearing the myth. So, ma'am, can you please let us know how can this vitamin A deficiency be prevented for pregnant women?
So, in pregnant women, what happens? There are 3 stages in pregnancy: first trimester, second trimester, and a third trimester. It's divided into 3 parts. So, in the first and second trimester, the need of vitamin A is a bit lower. But in the third trimester, when the baby grows, development grows very much, then the need for vitamin A increases. So what we should do is that we should keep the mothers before pregnancy only. They should be well nourished. They should be supplemented with vitamin A or in case of any infection or anything before pregnancy only, they should be given the sufficient amount of vitamin A replenishment, and they should be given the immunization, proper immunization, then to prevent other malnourishment, the proper nutrition, and then immunization and iron, folic acid replacement, everything should be done. And in case we see that the mother is having vitamin A deficiency, then in the third trimester, in very low amount of vitamin A can be given, which is a bit controversial, but still, according to WHO, after the second trimester, it can be given in very low doses. That's all.
Great. Thank you so much for letting us know. So now let's dive deeper into the questions. Ma'am, can you please help us understand these aspects in details? So the first question will be, how can vitamin A deficiency be prevented, especially in children and pregnant women?
First, vitamin A deficiency is a fat-soluble vitamin which is present in abundant quantity in our liver. So the storage usually lasts for 6 to 9 months. So in case of increased use of vitamin A, as in growing children, they need some very high amount of vitamin A. So if the store gets depleted, then only they get the vitamin A deficiency. So it should be like malnourishment when the child is not fed properly, if it gets not sufficient amount of breast milk, or they don't get the rich amount of breast milk from mother, or the kid is not fed properly by the mother, or they suffer from any other infectious diseases like measles, respiratory infection, or intestinal infection, or like any parasitic infestation, then what happens, the vitamin A, which is absorbed in the intestine, small intestine, it doesn't happen. So there will be vitamin A deficiency. Moreover, in case of malnutrition where there is protein deficiency, then in that case protein is needed for absorption of vitamin A. So that when the receptor, that transporter is not available, then also they will be getting a low amount of vitamin A. That's the cause of vitamin A deficiency actually.
Right. Thank you, ma'am. And the other question will be, what are the treatment options that are available for parents diagnosed with night blindness and due to vitamin A deficiency?
For vitamin A deficiency, the sole treatment is our supplementation or replacement of the vitamin A. So what happens in the stage of night blindness, the mother usually, first let me tell you about the symptoms, what happens, how the children gets diagnosed. Usually the mother sees that the child is not able to see in darker area, or the child is not able to get her mother in darker places. They can't identify the mother, and in that case only the mother identifies, okay, the child is having some problem. And in that case is usually what we should do, or we should try to replenish. When the mother or the child having vitamin D deficiency comes to the doctor, then we try to give them vitamin A. So it is reversible in the initial stages like dry eye stage or in the night blindness, where we should give a very high amount of vitamin A. It's like 2 lakh international units of vitamin A is given 2 successive doses. This is first day and the second day. Then the early symptoms, they are recovered in that case.
Sure. Thank you so much for the valuable answer. And the next question will be, how much is the recovery rate for patients suffering from vitamin A deficiency? Can they regain full vision?
Yeah, in the initial stages, it's 100% recovered. That is, in the night blindness stage and the dry eye stages, it's 100% recoverable. But in the later stages, there is guarded prognosis.
All right, thank you so much. Can you please let us know, how can we find out, or how can we know that someone is suffering from vitamin A deficiency?
So in case of ocular symptoms, that is eye related to eye, first is the night blindness, which I have mentioned initially. Then there is dryness of eye and bit-out spot. Yeah, bit-out spot is a very important thing. It's a white puffy triangular lesion found in the white of the eye, usually found in both the eyes laterally. Laterally means in the side of the black part, and that is called bit-out spot. Once a bit-out spot is there, you know that the child is having vitamin A deficiency. But sometimes we can get vito spot in adults also. In that case, we know that in some time of his life, the person has suffered from vitamin A deficiency, and there is conjunctival xerosis, that is dryness of eyes. In that case, what we see in the white part of the eye, it is drier, non-shiny, and it's a bit corrugated. And in case of the cornea, that is a central black part of the eye, the shiny lusterness of the bright eye. Usually we see what the eyes are brighter, but in those suffering from vitamin A, they have a dull looking eye. And in case of more of the, if the disease progresses, the black part, it may slowly become whiter too. And ultimately there is ulceration, that is there is scarring, and at the last stage we call it keratomalacia, that is the cornea, it gets melted down. If at that stage we can't prevent the disease, then ultimately we'll lose the vision, because the eye, it will burst, and once the eyeball burst, and it's a very rapid process, and in that case the vision loss is ultimate. And an extraocular person, those are the child, they have a scaly skin that is very dry looking, like fish like skin, then their hair, and then their growth is retarded, and they get frequent, that's vitamin A, it helps in keeping our body's immunity good, so they get frequent infections like measles. Again, it's a very it's a condition which ultimately again leads to vitamin A deficiency. And then diarrhea. So vitamin A deficiency, to prevent it, we should again control the measles and diarrhea. And in that case, the malnutrition. So what nowadays, what's doing our government is doing is that they try to supplement vitamin A with measles only at 9 months. That is given in the immunization schedule only.
Oh, ma'am, then can you let us know the prevention and the treatment as well?
Yeah. So for prevention, first we have to keep there is again a primary and secondary. Like in the primary, directly what we do is first prevention of infection, then immunization, and then we give the supplementation of vitamin A, and which is done again with vitamin A is given with immunization in the 9 month of when the baby attains 9 month. Then vitamin A is given in 1 lakh international unit orally, and after that every 6 months the vitamin is given. After 1 year, what we do is 2 lakh international unit is given every 6 months for next 6 years. So it will keep the vitamin A concentration in our body constant, as because it lasts for 6 to 9 months. And then the other part is that other infections are prevented by giving all those injections like polio vaccine, DPT vaccine, everything was given. And their nutrition is to be improved, like giving vitamin A rich food. Usually vitamin A rich food, those are found in mainly animal source and non-animal or plant source. So the animal source is the main source is the fish liver oil, and then the fish meat. Egg is a very good source. And then we have those other is milk, all the milk products. And in the but always this animal source is not available or not easily available for the poor people in our country like India. So we have to give stress on in non-animal products, like any colored food which is naturally colored, not those that cold drinks and not those things, but the naturally colored food like green leafy vegetables like spinach, then amarnath, all those things. And darker the color of the vegetable, the richer the source of vitamin A is there. And more about papaya, mango, oranges, pumpkin, and of course carrot.
Right. Thank you so much for letting us know. And then can you please let the viewers know the significance of the vitamin A deficiency?
Look, vitamin A deficiency, actually what happens, once a child gets, in India or in a developing country, the main cause of preventable blindness is a vitamin A deficiency. preventable blindness also, and the prevalence of vitamin A deficiency is almost 17.54% in our society in children. So it's a very significant amount. And then what happens if a child suffers from vitamin A deficiency? Then it implies that the child may have other, then there is 20% chance of getting other infections, and then there's the chances of mortality, that is the child dying of other diseases, it increases. So vitamin A deficiency, it actually implies a state of total malnourishment in the children. So that's the important thing, and so we should take care of the thing. Vitamin A deficiency means the child is deficient in all the things. I have seen cases like this. A child from a very well-fed family, the child had night blindness, and he was a very chubby child. So the thing is that non-availability of a balanced diet. So they were feeding all the things, fat, maybe carbohydrates, but the child was having vitamin A deficiency due to deficiency of the thing.
Thank you, ma'am. Thank you so much for the informative discussion. Can you please let us know what are the facilities available at the PA Sangma International Medical College and Hospital, and for eye deficiencies related to vitamin A deficiency?
Look, we have got all the facilities in our hospital for this treating a child diagnosed with vitamin A. We have the things like, and at the same time we can diagnose all the disorders, like the main is the refractive error and all diseases in our hospital. So we have a very good team of doctors and optometrists, and all the machines are available in our hospital. So my message is to the society or to all the people is that in case of any eye related problem, anything, not only vitamin A deficiency, you can just come to our hospital. It's open all the time. Our OPD timings is very flexible. Up to 2 or after 4 you will get everything. So just come to our hospital, step in, and in a very low cost, in a very nominal amount, you will get treatment. You will get a treatment. Every treatment is done in our hospital. So all of you are very much welcome to our PA Sangma International Medical College and Hospital to get treated.
Alright, thank you so much, ma'am. Lastly, can you please give a message to the viewers, whether it may be prevention or to take care of your body? Can you please let us know and give a message on that?
Look, we have already discussed all the things. Actually, what happens, first, our standard of living, then pregnancy, starting from pregnancy only, so restricted family size, and then spacing in between pregnancy, and then having kids, getting them immunized, and again antenatal care, getting all the vaccinations in proper time with good nutrition. Then after delivery also the proper immunization, proper feeding, and then again proper breastfeeding. There are different ways of breastfeeding also. How then it actually comes under the preventive things. Then proper weaning. Weaning means when the child, after 6 months, when the child starts having other foods, like then proper weaning is very important for them, so that and the vitamin A deficiency is not there. And then fortification of food, that is the food is fortified, like as we have seen before, there was one dalda, I think you remember, or I don't know you were of the era or not. So they were written like this, vitamin fortified with vitamin A and D, like that. And nowadays the milk that we are having, all those things are fortified with special amount of vitamin A or D, like that. So we can have fortified food. Then everything should be done. The balanced diet is an important thing. So these are the things: balanced diet, good then assessment to assess to good health care. Then again, one thing is this sanitation, proper sanitation. It's a very important thing, awareness and sanitation. And the basic thing is hand washing. So it's a very important thing to prevent any kind of infection. And availability of proper drinking water, all those things lead to a good health and good society and everything good.
Alright, thank you so much, ma'am, for letting us know.
Okay, thank you, Miss Ava, for inviting me here and giving me this opportunity to tell about our facilities and our availability. Thank you so much.
Alright, thank you so much, ma'am. That's a great takeaway. If you or anyone you know is suffering from night blindness, don't ignore it. Visit a specialist as soon as possible. PA Sangma International Medical College and Hospital, Meghalaya offers a great deal of eye facilities, and our team of experts are here to help. Thank you for tuning in. Do not forget to like, share, and subscribe to our podcast to know more about health insights. Thank you for tuning in. See you next episode.